So now we're going to dive into the different masks. And I'm going to start with the mask that I like to call like the catalog of masks, or the most efficient mask, which is the N95. So the N95 is this one. It filters 92 to 95% of the particles that we breathe, and is the most efficient mask that we have in the market, but it is reserved for only healthcare providers. It is hard to come because of that, because we prefer this mask to be reserved on only for healthcare providers. The other mask that are second in place in terms of filtration is the surgical mask that I showed you before. The surgical mask is really good because it has 3 layers, and actually, depending on the study, that can have to 86 to 92% of filtration, so really as efficient as the N95. And this mask, we prefer, when they're surgical masks, we prefer to be reserved for healthcare providers. And this is the mask that I use on a daily basis. Then I want to jump in some of the masks that we can find in the public. So this mask looks pretty similar to the surgical mask, but this mask is actually what is called a non-surgical single-use mask. So this mask has an excellent filtration rate. They actually have 3 layers. Typically, you will see that there's a blue layer, and that blue layer is the one that is going to see to the outside, and the white layer, you can appreciate, is going to one looking at your face. And remember, always when you wear this mask, snuggle in your face, covering your nose and your mouth, and make sure that is, depending on the size of your face, they have different size, large, medium, and small, so make sure you buy the right for you. And these ones are single use, so ideally you will use this once and then you will dispose. So for example, if you go somewhere and you're using these non-surgical masks that are single use, you may want to bring some along in case you want to wear a new one, or in case you've been using that for a long day or a long shift and you want to wear a new one. So these are available of any online or any of our local stores. You can find this mask. The other mask that I want to show is these are smaller non-surgical masks. These are really nice because it has some prints that the kids really enjoy. And this, you always have to make sure it's snugly and covers the nose and the mouth of your child. The third ones that I want to show is the cloth mask. And actually, this is my cloth mask that I wear outside the hospital. So this is a 2-layer mask actually, and is really snuggly. And one of the elements why I like this mask a lot is because, as you can see, has like straps, ear straps. And as you can see, when I put it in, I can adjust, and it covers my mouth, my nose, my mouth, and it's really snuggly, and there's no gaps in the middle. So actually it covers really well. And again, this is the one that I use when I'm outside the hospital. I'm not taking care of patients. And I want to show another one. This is actually my daughter's, and she's a 3-year-old, and this is her mask. And actually what I like about most is I can adjust the ear strap for her, and this will allow her not to be loose, and there's no gaps in the side. And I actually bought all these masks at a local store here, so actually also supporting some local businesses. This is another example of the mask with an elastic component. Again, 2 layers, always making sure it's your nose and your mouth really well, and it's snuggly. And I kind of brought this one too to show like multiple different ear straps that allow you to adjust. This is more for a kid. So those are all the cloth ones. Remember, when you pick up a cloth one, the key elements, 2 or more layers, cover that. The size has to cover your nose, your mouth, and it has to be snuggly on the side. The other element that I want to talk about is the bandana. We'll see a lot of bandanas out there. And the bandanas is not that they are bad, but actually the bandana, depending on the material and the fabric, can be really problematic, particularly if you don't fold it right. This can be only 1 layer, and really the filtration of 1 layer is like not wearing a mask. So I typically don't recommend bandanas, but if you have a bandana, make sure you fold it more than once to have 2 or more layers, and then that covers really well your nose, your mouth, and no gaps in the side. The next one that I want to talk about is the Gator. So the Gators are pretty nice. You probably have seen this in the street and in the retail shop. So these are like a scarf, and then you put it in your mouth, and you go in and out and take it out. So the problem with the Gator is that a lot of the Gators have actually only 1 layer. So if you have only 1 layer, really the filtration capacity of that is really low. But if you go now online, you will see that now you see 3 or more or multiple layers from the Gator, and it's actually pretty comfortable, and people really like it. But if it is only 1 layer, I will highly stay away from this type of mask or protection. This one is a valve one. I don't know if you can appreciate it, but this one basically we do not recommend using a valve because you can exhale the viral particles. There's some new ones now, new generations that are better, but the vast majority of them we do not recommend to use any mask that has an exhaustion valve or an exhale valve because it won't work to protect you from others to spread the virus. That's about it, I think.
And that's it.
Yeah, I don't know. Morgan, anything else? I don't know.
I think you did fantastic.
Well, I think that's fine. I don't know. I think there's going to be leaders.
I'm going to have a tough time now trying to squeeze that into my tiny little time slot.
Yeah, I mean, we can, I don't know. It is hard to the cdc.gov. And that link actually, gives you a lot of data about and guidance for people. And it's has graphics and maybe this individual will cough, talk, sing. They will film the particles and they will film what's the filtration rate of every single mask. And that's how we know this valve don't work. The bandanas are kind of crappy. The Gators, they don't work that well, unfortunately. So there's some easy graphics with the recommended and not recommended. So I think that can be a good resource for your team so they don't have to reinvent the wheel.
That sounds great. All of this sounds great.
Yeah, we didn't talk about face shields, but I don't think people use face shields.
Yeah, I don't see a lot of face shields around.
Yeah, I use it here. We used to see patients, so I don't think it's a topic that I need to talk. And then I do want to give you the heads up. And this is going to be a whole ball of wax, but we may, we're waiting for what is called a site selection for the Moderna COVID-19 vaccine for pediatrics to start a clinical trial in Sanford. And of course, you cannot say anything this live because it's not